Hello everyone. So in this video we will be discussing about nursing assessment. I am Pavithra, Assistant Professor, Department of Nursing Foundation, Yenepoya Nursing College. So learning objectives of this session. At the end of this class, students will be able to define nursing assessment, its characteristics, purposes, the types, understand the various skills which is required for the assessment and the process of nursing assessment as well. So we all know that nursing assessment is a first step in nursing process, which will mainly help to gather the information about the client's health status. It is a systematic and rational method where we collect the data in order and with a purpose for planning and providing a better individualized or personalized nursing care. So it involves systemic and continuous collection, organization, validation and documentation of data, which is carried out throughout the hospitalization process, right from the admission till the discharge as well as in the follow-up. Coming to the definition which is given by Jordan in the year 1994, assessment is the collection and interpretation of clinical information which focuses on gathering the data about client's state of wellness, functional ability, physical status, strength and responses to actual and potential health problems. So as we collect the data in a systematic manner, it not only focuses on the present problem but also focuses on patient's physical status, their strength as well as their potential health problems and the complications which may arise in the future. So that is about the definition. Coming to the purposes, assessment helps to identify the client needs as well as their problems. It also helps us to formulate the nursing diagnosis. For example, if the patient's need or the complaint is pain, so we can frame it as acute pain related to surgical incision as evidenced by pain scale score. It helps us to formulate the diagnosis. It also helps us to identify the strength and weakness of the client. Proper assessment will help us to organize the collected information in a better way. It provides a foundation for better quality nursing care, where individualized, personalized care can be given due to the proper assessment. So throughout the assessment process, we will be able to identify the knowledge status of the patient so that we can identify the need for health teaching. So these are some of the purposes of health assessment. Coming to the characteristics, it is cyclic and dynamic. Cyclic, it is a continuous process, and dynamic, it changes. The question we ask today and tomorrow it is different. So it is dynamic and it should be open and flexible. There is no hard and fast rule that you have to ask the same question to all the patients. It depends upon the patient as well as their disease condition. Always when we plan the assessment, it should be client centered. We should focus on the patient, their disease and their status, and it should be planned. So our assessment should be planned. There is no absolute beginning for assessment or there is no absolute end. And always we should focus on problem solving. Next, it should be goal directed, towards the goal or towards the purpose or towards the objectives. We should use our decision making skills, and whatever the data we collect, it should be universally applicable. So universally applicable is something which is accepted by everyone. And we have to use our critical thinking skills, like what question we have to ask for what type of disease condition. We have to use our thinking skills. Always when we ask the question or when we do an assessment, it should be directed towards the client's response as well as their disease condition, and it should emphasize on the feedback of the patient, feedback of the peer group or feedback of the colleagues or the seniors. So these are some of the characteristics of nursing assessment. Coming to the types of assessment, it is mainly divided as per the purpose, timing, the time available and the client status. So here we are mainly focusing on the client response to the health problem. There are mainly 4 types: initial nursing assessment, problem focused assessment, emergency assessment and time lapsed assessment. So initial assessment, which is performed within the specified time after the admission. During the initial meeting we need to assess, then it is called as initial assessment. For example, nursing admission assessment, where we collect the basic information from the patient. Whereas second one is problem focused assessment. Here we mainly focus on the specific problem. For example, fever. So hardly checking of vital signs for fever patient, or high blood pressure, hardly checking of BP of a particular patient. So we are focusing on the specific problem. Third one is emergency assessment. So here we assess in the emergency condition in order to identify the life-threatening situation. For example, in case of cardiac arrest, so rapid assessment of individual's airway, breathing and circulation. In case of head injury, rapid assessment of hemorrhage, airway, breathing, circulation. So it is during the emergency condition. Whereas fourth one is time lapsed. So here the data which is collected mainly to compare the current status with the data which is collected previously. Mainly we do it in the follow-up to see whether the pain is reduced or not, whether the symptoms is reduced or not. That is time lapse. So these are the 4 types of assessment. Coming to the skills required for health assessment, the skills is very essential. The first skill is the cognitive skill. So assessment is considered as critical thinking as well as decision making skill. So we have to critically think what we have to ask, how we have to assess is very important. Second one is problem solving skill. So solving the problem if the problem arises in between. We should mainly focus on problem solving. Third one is psychomotor skill, doing something, assessing, checking the BP or inspecting, palpating, percussing, auscultation, so which requires the skill, that is psychomotor skill. Fourth one is affective or interpersonal skill, the relationship which we maintain between the client and the nurse, where we have to develop a therapeutic relationship. And last one is the ethical skill, which mainly involves being responsible and accountable for the patient. So these are the skill which is required for the health assessment: cognitive skill, problem solving skill, psychomotor skill, affective skill as well as the ethical skill. Next, coming to the process of assessment, it mainly has 4 steps: collection of data, organization of the data, validation of the data and documentation of the data. So first step is the collecting data, so where we gather the information from the patient. So we can refer all the databases in order to gather the information from the patient. It can be through nursing history, it can be through physician's history or physical examination, or the results of the laboratory and diagnostic test. So blood test report or ultrasound report, CT report, etc. We can refer all the databases for the information. So gathering data or gathering information is very essential in order to provide a better care. There are mainly 2 types of data, the subjective data and the objective data. So subjective data is what the patient presents, okay, the symptoms, which is also called as covert data. So client sensation, their feeling, their beliefs, attitudes, perception, etc. So for example, patient tells that he is having pain, he is having breathing difficulty. So that is the subjective data. Objective data is the signs or the overt data, which is seen, heard, felt, smelled, observed, which we assess. As a nurse we assess, that is called as the subjective data. For example, the pain in the lower abdomen, fever, nausea, all those are the symptoms of appendicitis. Objective data where we have to check through the signs, so as sign, obturator sign. So subjective data is what the patient experiences, objective data is what the nurse examines. Sources of data, there are mainly 2 types, primary and secondary. So primary is where we directly collect from the patient. Secondary is where we collect from the family and significant others. If the patient is unconscious, if the patient is child, where we get the information from the significant people, or from the records, the previous records, or from the other healthcare professionals. So these are the sources of data. Next, the data collection method. There are mainly 3 types: the observation, the interviewing and the examining. So observation is where you observe the things, where you observe the patient, whereas interviewing is where we communicate with the patient, whereas examining is through the physical examination. So we will see one by one. First one is observation. So observation is where we gather the data by using our 5 senses. So here we have to observe both verbal and non-verbal behavior. So always you should see there is a match between the verbal as well as the patient's non-verbal behavior. For example, the signs and distress which is showed by the patient, or the temperature in case of fever patient, or the wound may be red, swollen, which is bleeding. Okay, there should be a match between the verbal and non-verbal behavior. Second type is interviewing. So here we develop a conversation with the patient. Always a conversation should be planned one. So there are three approaches: directive approach, non-directive approach and combination. So directive approach, it is a highly structured one, and here we ask only the necessary information or the specific information, especially we do during the emergency assessment. Whereas non-directive is rapport building. Okay, here usually we ask the open-ended questions, and combination, it includes both directive and non-directive. So types of interview question, there are mainly two types: closed or open-ended question, neutral or leading question. So in the closed-ended question, here the client need to answer either yes or no. Do you have pain? Where is the pain? How is the pain? Okay, it is a closed-ended question, either yes or no or one word answer. Whereas open-ended question is where the patient has a full liberty to describe each and everything what he feels. It is mainly based upon the broad topic. So how do you feel? How do you feel after a surgery? How do you feel before and after the surgery? It is an open-ended question. Patient has full liberty to answer each and everything. Second one is neutral or leading questions. So here neutral questions are the questions where the client can answer without any pressure or without any particular direction. For example, can you describe about your pain? Here patient can tell where is the pain, how is the pain, when it increases, when it decreases, etc. Whereas leading question is, here we guide the patient towards a desired answer. We need one answer. Do you have stabbing pain or pricking pain? So do you have pain in the arm or do you have pain in the leg? So do you prefer open surgery or do you prefer a laparotomy surgery? We need a particular answer, desired answer. That is called as the leading question. So these are the two type of interview question usually we ask: closed and open-ended, neutral or leading question. Next is planning for the interview. So we have to plan and prepare for the interview in terms of time, place, seating arrangement and the distance. So time, it should be convenient for the patient and there should not be any interruptions in between. So place, you have to set an appropriate place, either it can be an examination room or a patient bedside. So we have to arrange a formal seating arrangement. If the patient is bedridden, then we can raise the head end of the patient. Adequate distance need to be maintained between the nurse and the patient, preferably 2 to 3 feet distance. It should not be too close or it should not be too far. So these are the things which need to be planned prior to the interview. Next, coming to the stages of interview, there are 4 stages. First is establishing rapport, second is orientation stage, third is body and fourth one is closing. So first, in establishing rapport, where we greet to the patient, we introduce ourselves. So once it is done, we move on to the orientation stage where we explain the purpose and nature of our interview or nature of our conversation. And in the body, we ask then exact information which is required about the patient condition or about his particular symptoms. Okay, here usually we ask open type of question, open-ended questions. So once we get the necessary information, then we close the interview. Or in between, if the patient feels uncomfortable, then we have to close and schedule it for another day. So these are the stages of interview: establishing rapport, orientation stage, body and closing stage. Third technique of data collection is examining, where we examine the patient through physical examination. So where we will be able to identify each and everything in a systematic manner. So here mainly we use the 4 techniques: the inspection, palpation, percussion and auscultation. So inspection, we inspect for the things, maybe wound appears red, wound appears swollen, there is a discharge, etc. Whereas palpation is where we palpate using a finger pads for any swelling or any mass. It can be light palpation or a deep palpation. Whereas percussion is where you percuss the area in order to identify whether there is a gas accumulation or a fluid accumulation. Whereas auscultation is where you auscultate for the sound. It can be heart sound or it can be breath sound or it can be a bubble sound. So where we use these techniques for the physical examination. We can go for head-to-toe approach or a system-wise examination. Head-to-toe approach is where you examine from the head till the toe in a systematic manner. Whereas system-wise is the particular system which is affected. It can be neurological system, or it can be eye, it can be ear, cardiovascular system or respiratory system, abdomen, musculoskeletal system, integumentary system, etc. So system-wise is examined as per the disease condition. Or the screening examination to screen something, maybe breast examination, eye examination, or the testicular examination, where we examine the part. So once we collect the data by observation, interview and examining, so we have to organize the findings in a systematic manner using a various format. It can be a nursing health history format or a nursing assessment format. So whatever the data which is collected, it should be appropriate to the format. So chief complaints, present medical history, past medical history, family history, personal history, etc. So it should be placed in particular area. Or we can organize as per the structured assessment tools which is available, Jordan's functional state, functional health pattern, ORM or Roy's adaptation. So we can apply to that format and organize in a systematic manner. So proper organization also helps in better planning the care. So once we organize the data, we have to validate the data. So validation is you are double checking or verifying the data to confirm it is complete, it is accurate, it is factual and it is correct. So there should be an agreement between your objective and subjective data, that what the patient tells and what you found. There should be an agreement or there should be a match between the objective and subjective data. So as you validate the data, you will get an idea whether there is a need for additional information. Do you need to collect the data more from the patient? When we are validating the data, always we have to differentiate between the cues and the inferences. Cues are the signs and symptoms or the subjective and objective data which is seen, heard, felt, smelled or measured. Whereas inferences are the conclusion which is drawn from the cues or the interpretation which is drawn from the cues. For example, the nurse observes the incision is red, hot and swollen. So we can inference or interpret it as incision is infected. Or patient presents the symptoms of appendicitis such as pain in the lower abdomen, fever, vomiting, etc. interpreted as appendicitis. So it should be differentiated properly, cues and inferences. Next, coming to the guidelines for validating data. So always you should compare the objective and subjective data. It should match. If the patient is having a pain, you should mention the pain score. Always avoid ambiguous or vague statements. If there is any confusing statement, it need to be clarified. Be sure that data consists of cues, not the inference. We have to write in terms of signs and symptoms, not as an interpretation or a inference. Always double check the data that are extremely abnormal. If the pulse rate is very high or if the pulse rate is very low, if the BP is very high, double check it, or you can ask the other person to check. So double check the data. So determine the presence of factors that may interfere with the accurate measurement. For example, if you are checking the respiration of a child during crying, the respiratory rate will be high. Or checking BP immediately after the physical activity, it will be high. So make sure that you identify those factors and then you check the measurement. So these are some of the guidelines for validating the data. So once we validate the data, we document the data. So appropriate and accurate documentation is very, very necessary. Based on this, the further care or further treatment will be planned. So whatever the data which is recorded, it should be in a factual manner. As I said, it should be in a cues form, not as interpretation or not as a conclusion. For example, the nurse records the client's breakfast intake as coffee, juice or egg. So rather than writing as appetite good, we have to write the signs and symptoms of the patient rather than the final conclusion or interpretation. It should be in a brief and it should be in a factual manner. So that is about the process of assessment. So far we have discussed about the definition, purposes, characteristics, various types, the skills required for nursing assessment and the process of nursing assessment. To conclude, the nursing assessment involves collecting data mainly to identify the patient health status. So it involves both subjective and objective data. So where we collect using various methods. So whatever the data which is collected, we organize it, we validate it and finally document it for further appropriate plan of care. So these are the references. Thank you.